Good afternoon on this snowy day in Columbus, Ohio, where we have some bitter cold weather. I gather that the weather across the ocean in Israel is quite similar, so we share some things in common on this blustery day. Like the rest of the world, we are all watching Israel's success in vaccine rollout. A third of the country has been vaccinated, or at least it was a third of the country at the time that we announced this talk. Nadav will correct me if they have now exceeded that bar, but they haven't done it without also having to address their own implementation challenges and their own ethical dilemmas. And it is my pleasure today to introduce an old friend who has been central to Israel's success and Israel's vaccine rollout. Dr. Nadav Davidovitch is professor and director of the School of Public Health at the Faculty of Health Sciences at Ben-Gurion University of the Negev in Israel. He is essentially my counterpart in his country. He's one of the most accomplished people I know. He's a physician and social justice champion, a stellar historian, an astute and influential public health practitioner who works not only on a regional and national scale, but on a global scale. I'm going to hand over the screen to Nadav in just a second, who will speak for about 20 minutes, and then we'll transition into discussion and audience Q&A. As he speaks, please submit your questions through the Q&A feature. And with that, I'm not going to delay any longer the business of learning from the kind of person who normally makes me feel woefully inadequate. But thank goodness that Nadav is not only brilliant, but he is routinely the cause of brilliance in others. So he's always someone who leaves me feeling lifted up, and I expect that he will do that with us today too. So Nadav, welcome to Columbus, Ohio. Welcome to The Ohio State University and the College of Public Health.
Wow, Amy, thank you so much. I'm blushing. So just to tell you that I have family also in Columbus, Ohio. My uncle was a professor. He's now probably 84, so he retired. And also one of my cousins. So it's kind of a hometown. And Amy is such a close friend, and don't believe her. Everything she said, it's actually about her, and I learned from her so much. We were so glad to have Amy. Just I told her BC, before Corona in Israel, we had a session about personalized medicine and other issues, and we share some common interests also in the history of migration and health. And of course, vaccinations. Amy, who would believe that our boring historical and ethic discussions would be now so relevant around the globe? So I'm going to share with you some of the data. Hope you can see now. So first of all, and I can give you the website later. We have now all the data really easily available on the website. It looks now very straightforward and easy, but believe me, it took us several months and lots of chaos at the beginning. Israel now is trying to get out of a third lockdown. I am on the National Advisory Board of COVID-19. I'm also a member of the task force, as was maybe mentioned in the announcement, for the Association of Schools of Public Health in the European region. And it's unbelievable. We're being called by all over the world. I just had sessions with Italy, Uruguay, Ecuador, many different countries to understand what's going on in Israel. And indeed, here you can see this is February 14th, and actually every day you need to change the data. Today we celebrated the 4 million person that was vaccinated. Israel is about 9 million people, so we are close to have half of the country vaccinated. Of course, we're talking about one dose. The second dose, it's now about 25%. But I think that what is extremely impressive that you can see here, people that are above 70, you can see that many of them are already vaccinated with the second dose. Israel opened just last week. Now everyone can be vaccinated from 16 and above. 16 because this is what Pfizer were doing their clinical trial. All the world is now looking for the results of clinical trials with children. And of course, a major part of the problem now that we cannot get into herd immunity without vaccinating children. And since we had the new variants, Israel now, about 80% of our new cases are the UK variant. I know that in the US, this is still ongoing, and the UK variant is much, much faster. And now it includes also children that were less of a factor in the first and second wave in Israel, and now we have infection among them probably 4 times more. And you can see here the comparison. Here we see just a few days ago the situation about the one vaccine dose. So you can see that Israel, and again, it's even a bit higher. We are very close to 50% almost now. And you can see the rest of the world. You can see here the US. And here, maybe even more impressive, you can see the second dose already close to 1/3 of the country. And you can see that other countries like the US, it's only about 4%. So why Israel became such an example? And I think that probably it's important to remember that it's a multi-layered story. So what are the characteristics of the Israeli healthcare system? I guess that many of you probably are not aware. So first of all, we have a national health insurance law. It was enacted in 1994, very close when Hillary Clinton failed to have a single payer system. And what is interesting also that when it was voted, now it looks almost science fiction, but both right party, Likud, now Netanyahu is the head of the Likud party, and the Labour Party that then was the ruling power, and now it's a very small one, unfortunately. Both of them, so right and left, voted in favor of the national health insurance law. So health insurance in Israel, and again, single payer system is something that we're very proud of, both right and left. Of course, there are many issues about private-public mix and other things, but of course we are in a very different situation than in the States. The system is a Bismarckian system, so it's operated by health plans. These are non-profit, they are national, they are competing. They cannot compete for the premium, but they can compete for other things, but that's a topic for another lecture. But what is important that they are responsible for provision of healthcare, and they have some advantages like the national health system, like in the UK, that they direct employ nurses. Nurses are the main factor in rolling this vaccination campaign. And they have the advantage above the private system because it's not fragmented. Sorry about that. On the other hand, Israel has a national health expenditure is about 7.5% of GDP. In the US, I think now it's 17 or 18. In the OECD countries, it's about 9.5 or 10%. So we have issues in funding and rates of nurses and hospital beds per population that are lower than OECD average. So on one hand, we have a very important factor that we have a national health insurance law. We have the health plans that are covering all the citizens, all above, all throughout the nation, including in the periphery. On the other hand, we have our problems with a shortage of nurses. And this is alone won't explain our really stunning success. So probably the main issue, of course, is availability. We see now around the world, and I'll get back to it by the end of the presentation, mainly about the Palestinian Authority and what we are doing. We're going to submit, unfortunately, a Supreme Court petition about that. I'll speak about it at the end. So Israel had enough doses, and it's important to understand that Israel has an agreement. Actually, the first agreement was signed with Moderna. We're very proud because the medical officer of Moderna is a graduate of Ben-Gurion University, School of Medicine, Professor Tal Zaks. And then also signed an agreement with Pfizer. And Pfizer decided that Israel will be like a model in asking questions such as what should be the herd immunity. And Israel is an excellent candidate because we have a universal coherent electronic medical records that is really amazing and give us also the opportunity to do lots of research, including issues of big data. And also we have, unfortunately, or fortunately, I don't know, it depends, and we get back to it discussing the ethical questions. So our privacy and data protection law are probably more relaxed than, for example, in the US. And the last time that they were updated, they were in the 90s. And this is something that I am myself very engaged related to issues of big data. Actually, Professor Amy Fairchild, your dean, visited Israel. We had an international workshop about a year and a half ago on that. So in many ways, it's a kind of a paradise, for doing the phase 4 surveillance. I'm very critical about it that this is not a human experimentation. Phase 4 is a post-marketing surveillance. Amy published a book with some of her colleagues back about public health surveillance and the ethical issues, and I think there are really relevant questions also here. Now, this is great, but because we have these kind of agreements based on vaccine nationalism, I'm sure you heard the term, so everything is very, very secret. I myself, as an advisor, signed on a secrecy agreement. I think it's very bad. It's very bad for trust. And many times, actually, there is no reason for this secrecy, but we are signed. It was even a secret how many doses Israel is going to get. And you're probably aware that there is around a report saying that because of this vaccine nationalism, that finally, mainly high-income countries are now vaccinating, and we don't have, equal access around the globe. This is going to cost more than $1 trillion because if we want to control, I'm not talking about eradicate, but to control the pandemic, it's a very bad idea to have only some of the countries, and there are problems of within country inequalities related to vaccination access and availability, and of course, between countries. But again, this is not enough. Of course, you must have as a prerequisite the the vaccines available. But again, we were very, very fast in doing the rollout. And here we have a question of provision. And don't worry, I'll get you also to the problems. Nothing is perfect. So Israel decided to rely on the health plans. And this is not maybe a trivial decision, because in Israel, actually, children vaccination are done mostly by the government, by the Ministry of Health, by mother and child healthcare centers, historically called drop of milk stations, that were established, many of them even before the establishment of Israel. It's an integral part of our history and pride. So the decision was to rely on the health plans. And this was very important because they are very experienced. They have the infrastructure. And also, and I was taking part in many of these drills in the last decade or so, because of preparedness for emergencies, we had many drills on mass vaccination. We were mainly planning for pandemic influenza, but actually this is quite similar. So we were doing drills, of course, not all over the country, but first of all, decision-making, drills about prioritization, about ethical issues. So that's something that is being discussed. And there were also roundtables between the different stakeholders, and also actual drills in the field, usually in a certain area of the country. It can be in a stadium in Jerusalem or in other places. These health plans, they have the IT infrastructure that are also easy to make appointments. Again, at the beginning, first few days, there were problems, but quite quickly they were solved. There are the electronic medical records, as I said, so this made the whole question of prioritization very easy. I know that in the US, this is a nightmare because the health plan, they have in your electronic medical record, they have, of course, your age, other high-risk conditions such as chronic illnesses, etc. And they can actually, doing a very active intervention of calling people that are not vaccinated, like they're doing now, while the Ministry of Health is giving incentives to the four competing nonprofit health funds for those who have higher rates of vaccination. The primary clinics are spread over the country, including in remote areas. Ben-Gurion University is located in the Negev, as Amy presented me. This is the south of Israel. Everything is relational because it's 1 hour from Tel Aviv, but it's considered sometime more in the periphery, 1 hour by train. But there are more remote areas. Israel is about the size of New Jersey, by the way. Nurses can vaccinate because they are authorized, even without physician being present. There should be a physician on call. People that suffered from previous major allergic reaction, they can go to a special allergic clinic to be surveyed. And the nurses are employed by health plans, so the deployment for the vaccination campaign was relatively easy. But of course, again, this is not enough because you need to talk also about compliance, because if you have the vaccine and you can distribute them very quickly, but if people are not compliant, you're in a big problem. Look what's happening now in France and other countries. And here, I think this was also very interesting to see, both top-down by the Ministry of Health and the Israeli Medical Association. I'm also the chair of the Israeli Public Health Physician Association. So there were awareness campaigns, different public figures from all different parts, also from art and culture, sports, political figures actually were taking the jab and being on TV. But maybe even more important, and I'll explain in a moment why, also bottom up, many times unplanned initiatives. So together with civic societies, we have an organization called in Hebrew Midat. It's like Informed, that are doing lots of work about refuting fake news, but also WhatsApp groups about leftovers, because you know that because of the logistics, when you get the Pfizer vaccines out of the refrigerators, you have a certain amount of time. And especially at the beginning, there was a sense like of a race for the vaccine. It became very popular, and it reduced hesitancy that, just a few months before, people were asked, and many were kind of hesitant. But again, the question of compliance is still ongoing. You saw that those who are 70 and above are the vaccination rate is very high, but we now want to move to those who are 14 above, 15 above, because of the high vaccination rates in those who are, among the elderly. We see that we have now more severe cases in those who are 40 and 50. So these kind of bottom-up issues intervention are very, very important. And here you can see also, if you're asking about one of the major challenges is, of course, the question of minorities or migrants. So in Israel, we're talking about ultra-Orthodox Jews and Arabs. So we invested lots of thought and collaboration with NGOs in the Negev, the south of Israel. We are working with the Arab Physicians Medical Association. I just visited last Saturday in a Bedouin town called Negev Shalom. And they are working, going house to house, engaging the community, the municipality. Sometimes some municipalities are doing lotteries. Sometimes bringing food. I don't know how familiar you are with the Jewish Jewish food, but in the Orthodox community, they were bringing cholent. It's a Jewish dish, or blinches, or piroshki, or other things, or just falafel or hummus for people being vaccinated. So just to conclude, and I want also to speak about the Palestinian condition. So there are several factors that are very important. So we are talking about availability, the early procurement from Pfizer, and also the IT and electronic medical records. There are many ethical questions here. Are we maybe going too far about privacy and data protection? Today there was a bill suggested that we're going to object the Israeli Physician Association, Public Health Physician Association, about giving the data to municipalities in order to put pressure on citizens. We don't think it's a good idea. These kind of similar questions, Amy, if you remember, you were dealing with the discussion about diabetes. We have the question of nurses that are deployed, that maybe they're working too much focused on vaccination. What about other things that are not corona related? And this is a major question all over, that we are maybe sometimes too much focusing on corona and leaving aside other things. And again, the question of compliance and the campaign to reduce hesitancy, is it to be enough? And maybe, what is the line? Are we crossing the line maybe from persuasion and moving maybe to some kind of compulsion? I'm against compulsion, of course, but should we give only positive incentives? What about other incentives? That's something that is very important. And just to finish, I want to bring the question of the Palestinians. So I was part of this report statement about the right of vaccination that must be extended to Palestinians, not only from moral reasons, but also from utilitarian reasons. There are lots of exchange between the borders, and this is probably a very bad idea not to vaccinate Palestinians. All the public health community is supporting this, but lots of political issues. So we have Arab and Palestinian citizens, and we have also Palestinians in jails that were vaccinated. This was also an issue. And the question of what should be the relationship between Israel and the Palestinian Authority, and the responsibility of Israel as after the occupying the West Bank and Gaza. That's a major question. So You can read the blog that we published on BMJ, British Medical Journal, Israel vaccination rollout, short-term success, but question for the long run, that in many ways summarize some parts of what I was presenting here. So thank you so much. Toda rabah. This is in Hebrew, and I'll be happy to answer some questions.
Thank you, Nadav. And I'm glad we have some time to go over questions. We've gotten some good questions already. We got some ahead of the talk today, and many of them will give you an opportunity to elaborate a little bit more on some of the themes you touched on. One of the things that's on our mind here at OSU, but in the country more broadly, as we talk about the things we know and don't know about what vaccine protects against. We know it protects against the development of severe disease. We don't know if it prevents transmission. So what's been Israel's experience with the public willingness to wear masks after vaccination?
Right, so I'll start with the first part of your question. It wasn't a question, but I want to elaborate on that because we have now some data. I myself involved in some studies. So we have several major studies, and it's clear, first of all, that, again, phase 4 post-marketing in the field and not in a clinical trial. So the efficacy is still 94, 95% across all ages. And it's not only giving you personal protection, it's also protecting you from infecting other people. And this is a major issue. It's not clear if it's a 50% reduction in infecting other people, or maybe 60, 70, 80%. But this is a range. I promise, Amy, to give you, even before it's published, some hints. All the world is waiting to hear from us because it has major consequences for policy and also from ethical perspective, because it's very different if you just protected yourself or you also prevented from infecting other people. Then also the ethical question is different. In terms of people wearing masks, so we went into different phases. First of all, wearing masks in Israel is not as political as in the US. It was very, very objected at the beginning, but later, because of I participated in another study, including the social and ethical issue, but it's another, maybe you should invite me to another presentation about masks. It's fascinating, just thinking about such a simple thing as mask, how so much emotion it created. So people are complying, are wearing masks, even if are vaccinated. By the way, I was vaccinated, my second dose 5 weeks ago, almost now. So I'm turning green. We're going to have, I didn't speak about the green, we don't like to call it green passport, green standard. It's another question and lots of issues. The WHO is not so much in favor of having a green passport because of the inequalities, because many countries don't have. But within the country, we have access for everybody to be vaccinated. So the green standard will be those who are vaccinated, those who recovered. For now, vaccinated, it's for 6 months, maybe to be extended depending on the data, probably to be extended. And for those who recovered for 9 months, again, same thing, maybe to be extended. And we insisted, and this is still an ongoing debate, because this whole green standard will start to operate only from next week. After we can have it now on our cell phone, we can have an app. It doesn't matter what health plan you are, you can get it. So we insist that there be an option also for people to have a rapid test. If, for example, if they want to enter into a sport event or some other events, because otherwise we think it's a kind of a burden for those who may be refusing. And we think it's a nag to be asked to do all time the test, that maybe to be enough for those who are hesitant, maybe to vaccinate, and those who are refusing, okay, so we give you the option to do the test. So people are wearing masks. I'm not saying it's perfect, but it's there's a much better compliance than used to be. Our problems are not with the mask. Our problem with mass gatherings, especially weddings, especially in the ultra-Orthodox communities. But again, it's a different story. And this is why we want to have the green standard, because you cannot go with the pandemic fatigue, pandemic anger, even saying, everything is forbidden. So why are you doing the vaccination campaign? So we're saying, let's give some options that are, Amy, you did a lot of work on harm reduction. So maybe let's do something that is more balanced, because if you're saying nothing is allowed, people will go and do whatever they like finally. So there'll be an option probably to have even weddings, but under certain standards, maybe up to 100 people in a certain space, only people that were vaccinated, recovered, and taking the rapid tests.
So can you, I'm interested in the issue of vaccine passports. I've been part of a group that's been informing the Ada Lovelace Institute in the UK. And how extensive is uptake of the vaccine passport? Where are the kinds of places that you have to show it, and have there been discussions about any limits? So there's some places where it's not required, particularly if you're masking. How extensive do you see that being used eventually once everybody has 2 full doses, or at least has had the opportunity for 2 full doses?
So first of all, the so-called green passport or green standard is still under debate, and it's going to be implemented only next week. So it's a big issue right now, and I'm like every day in different committees discussing this. I'd say that first of all, for now, the only thing that you get being vaccinated, that, for example, if I'm now exposed to someone in Israel, I don't need to be in quarantine. Shir, my daughter that unfortunately was exposed. She was supposed to get the first vaccine. She was not on the priority up until several days ago. It was open to young people only about maybe a week ago, something like that. So she signed to do the vaccine and was exposed to a friend, a student, just about a week ago. So you can do 2 tests, blah, blah, blah. That's another story. But for now, if I'm exposed, I don't need to be in quarantine. Also, if I'm returning from abroad, but now the airport is closed, so it's kind of impossible. But let's say I was abroad, and if I'm doing the tests, I don't need to do a quarantine. Other people need to do both the test and the quarantine. And the fact that you need to do the test, even if you are with the green passport, is because of the new variants.
Yes.
That being, from next week, so again, there is a debate. Things that will be more for a pleasure, let's say, like cultural events, things like that, you'll need the green standard. Things like public transportation, going into a grocery store to buy something. This is not there. Nobody can ask you for the green standard because it's perceived as something that is necessary. So that's kind of the line. But again, we are having tomorrow a parliament discussion that I'm participating, and it's not decided yet. It's now, what is horrible, Amy? We have, and this was similar with Obamacare. We have now people, it's a kind of marginal, people that are taking Nazi pictures and are showing the Minister of Health in Israel dressed as Mengele, saying that what you're doing now with all the incentives, and again, it's not compulsory. We're only doing this green standard, etc. Some people are saying this is like we are turning into a Nazi state. So the Jewish state is turning a Nazi state because we want people to be vaccinated. And again, not compulsion. Now, it's a very marginal, but I found it on the personal level crazy. From a researcher level, of course, it's fascinating, but it's quite horrible.
Well, so that's and one of our questions is, I'm going to jump ahead. They specifically want to know whether Israel has an anti-vaxxer group like we do in the U.S. and how have you handled that vaccine rollout backlash? It sounds like some of this is not necessarily coming from an anti-vaccination perspective, but maybe a surveillance state perspective. So can you talk about whether those two intersect? Are they distinct?
Sure. So you know very well of course the history of anti-vaxxers, etc. Of course, we have the Israeli version. So we don't have a anti-vaccination so strong as in the US. Again, it's part of our culture. And we can use the term solidarity and feel very good about it. While in the US, when you're talking about solidarity, you're immediately kind of attacked that you are communist or something like that. You prefer social justice, or it's something we discussed in the past, Amy, I think. So it's a minor phenomenon. I would say that maybe 5% are really, hardcore anti-vaxxers from different kinds that I will explain in a second. And there are many people that are hesitant. And those who are hesitant, many times while I'm doing lots of webinars, and again, these kind of bottom-up initiatives are quite good in convincing people. And there are lots of behavioral and economics kind of tricks to do that, but let's leave it aside. The anti-vaxxers are divided into those who are kind of new age, that can be secular, religious people that are also new age, some religious people, ultra-Orthodox, that are against the state, the anti-Zionist, etc., and they perceive the vaccination being as a Zionist something. People that are against pharma, people that are against Netanyahu, because Netanyahu, although there can be some similar, and I'm sorry people will be maybe offended, lines with Trump, Netanyahu is very different than Trump. Netanyahu is a strong believer in science. He was maybe the opposite. He was for lockdowns. But Netanyahu also, for him, I didn't mention it, but the political will of Netanyahu being so heavily involved, because we are very soon having our fourth election in 2 years, just in a few weeks. So for Netanyahu, and I just want to say that I wish that all other parts of pandemic control, pandemic kind of interventions were so successful like vaccination. In many other things, we had our own issues, and that's another topic for discussion. But with vaccination, it's quite successful with the problem I mentioned, but many people recognize vaccination as they think it's like a political trick by Netanyahu. And they're so blinded by their hate of Netanyahu, so they're against vaccination. Again, it's a minority. So I think that it's a very, very non-monolithic phenomenon. It's very strange because you can find it on the far right and the far left. And sometimes you have very strange allies here. And some indeed are mainly not so much against vaccination. Maybe they're even going to be vaccinated, but they're strongly, strongly against this whole issue of privacy and surveillance. But again, privacy issues in Israel are not so central as in the US. It's a bit different.
So you alluded to this a little bit. What has been can you talk some about the kinds of fake news? Has fake news been an issue? What have been the specific challenges? And critically, one of our viewers wants to know, how did you combat the challenges of fake news?
Yeah, so of course we had our fake news. I think the major one was about fertility. And this is very powerful among the ultra-Orthodox and the Arab community. So you're bringing all the information, scientific information. I think also you need to be very empathic, for some of the hesitancy and be truthful, and present exactly what you know about the vaccine, what we don't know, and especially presenting what are the risks of, being infected with COVID, even if you are young, and the long COVID symptoms and all of that, and what are the very, very theoretical risks of having a vaccine. Other fake news were related to we probably heard about ADE, all these kind of immunological storms and things that happen with dengue. So again, we are refuting. The other things that maybe are not so much fake news, but are being repeatedly mentioned, like that the CEO of Pfizer, he didn't vaccinate, so why is doing so? I was asked today in the media. And by the way, it's a good question. Maybe you have a better answer. I said that he's very noble and he didn't want to go ahead of the prioritization, but I have no idea. I think it's a bit strange. I think it's better that you'll be vaccinated right now. Having one vaccine, it will refute many of the fake news about it. There are lots of people that are against the anti-pharma, and maybe they have lots of good reasons to do so, but I don't think they should, impeding you for. I can tell a lot of things about Coca-Cola and other things. There are lots of, and here we're talking about really an amazing vaccine that is going to revolutionize all of our, vaccine programs for other illnesses and of course cancer treatment. And I'm telling many people that if I have now on the table Moderna and Pfizer, again, I was vaccinated, but in Israel now only Moderna and Pfizer are approved. If I have them on the table and I have a previous generation vaccine, I prefer Moderna and Pfizer. It's much more targeted and really nice. And again, lots of use of images like the Nazi images. Do you remember with Obamacare that Obama was presented as a Nazi figure? It's all about the involvement of the state. Of course, the chips that are, but this is not fake news because there are chips in the vaccine. Of course, I'm kidding.
Thank you so much, Nadav.
Yeah, it's being recorded. No, we had lots of jokes about it, and the fertility issue is even larger. It's about Bill Gates and all people. But of course, Amy, we need to be more. Just dismissing it as rubbish, I think it's problematic because there is a history of colonialism and giving shots for fertility issues, including in Israel with the Ethiopian Jews. So I can sometimes imagine where this is coming from. So you need to present the problem in the history of public health, but saying, this is not the case. This is for your benefit. And again, the harm reduction thing and the risk benefit issue.
Well, so that's another question that's come up here. Can you talk some more about some of the groups that are harder to reach? What groups are those? What kinds of is the vaccination uptake rate lower? Is that the result of lack of access, lack of trust?
Right. So these are quite of the major challenges that I mentioned. We also wrote a bit about in the piece in the British Medical Journal. So the main two groups are the ultra-Orthodox community and the Arab community. And again, both of them are not monolithic. And now the situation is improving, quite rapid improvement. At the beginning, with the Arab community, especially in the periphery, like the Bedouin community, was a question of access. It took some time to open. I'm talking about like 1 to 2 weeks delay, right? But you saw how rapid was the rollout, so it looked like a crazy gap. And now it's improving. So it was a question initially of access that was improved, and then the fake news. We were working with rabbis and the religious leaders, also imams in the Islamic leaders, to write letters and fatwa. It's a kind of a halachic, like a religious rule, supporting vaccinations. Now, so it's so dynamic that every week, if we have another challenge. So now I think that the main challenge are the younger population. And I'm not talking necessarily, those who are 20, 30, 40. So there are lots of amazing, even improvised interventions, like different municipalities that are taking initiatives. And there are lots of wonderful things that, COVID actually is a kind of a mirror reflecting many of the problems in our societies, but, it's up to us. And there are lots of kind of solutions, sometimes like good practices being developed in certain places that we can learn and have them after, this will be over. And I promise all of you, it's going to be over. I promise you. I want to mention, Amy, maybe you were also interviewed there, I'm not sure. The really nice piece by Gina Colata, I think was May, when epidemic ends. And I think Alan Brandt was interviewed and Dora Varga, that we need to be very, we need to have the humility that not the epidemiologists are going to decide. It's probably a much better, much broader issue, of course, the socio-political and economic processes. And of course, we must say, and didn't mention it, I'm always mentioning it, that of course vaccines are not going to solve all of our problems. It's not a magic bullet. They're not going to solve the underfunded public healthcare systems. They're not going to solve all the inequalities. And in many ways, sometimes it's easier to have a vaccine as a solution. So I'm supporting vaccination, but I always want to remind people that it can be only one component of something that is much broader. And we're going to enter into phase, we're already there, of all the economic hurdles and the inequalities. I'm following also what's going on in the States and, the issue of race. So we are going to these communities and doing lots of, involving a family physician. Sometimes it's much better than getting a message from some vague person from the Ministry of Health. Working also on social media, TikTok, and the things that you like those things. You are kind of, I remember you.
That's right. That's right. That's right.
I see you on Twitter all the time. I don't know how you have the nerves to do it, but we must.
No, that's right. Well, yeah, sometimes it does take a little bit of nerve.
Yeah.
So let me go back to the, because you clearly get the question all the time, like I do. We have audience members who are interested in, has there been any discussion about when, two things, when is the airport going to reopen? And what levels of vaccination are you looking to achieve in order to begin to say we can open up more of society, open up tourism?
Right. Okay, so unfortunately, we're not going to get into herd immunity quite soon because we don't have vaccines for children. All of us are waiting for Pfizer, AstraZeneca, and for the approval. Probably we need to get, it's almost like cooking, I guess, sometime. I have all the formula, but believe me, it's more complicated, especially because of the UK variant. So remember the beginning, they were talking about 70%. Now it's 80%. Fauci even said more than 90%. So probably somewhere above 85, 90%. And because we don't have vaccine for children, it's a problem. But as I said, from next week, we're going to open some parts according to green standard, meaning it's not just about those who were vaccinated or recovered, but also, things that are outdoors will be more permissive than things that are indoor. And we're going to introduce also rapid testing. So I think we need to develop a multi-layer strategy in order to get as quick as we can, but in a careful manner, to the new normal, as we call it right now. I think that probably by the summer, we're going to have vaccines for children, and then it will be something different. But COVID, SARS-CoV-2 will become an endemic disease. It's quite clear, like we have other corona viruses with us every winter, or they were recognized already in the 60s. And maybe, probably, I'm not sure, but there is a good chance that this will be introduced into the routine vaccination program.
Mm-hmm. Good. So thank you, Nadav. And you've anticipated, as we've talked, a lot of the questions that have been coming up in the chat. So thank you very much for that. One of the specific questions in terms of the rollout has been, was the rollout and is the rollout strictly by age, or has consideration been given to comorbidities that put somebody at higher risk? How have you balanced age and other factors?
Right. So again, we were very lucky because we had enough vaccines from the beginning. So we started with healthcare workers and people above 60. Then the next stage were people with chronic illnesses below 60. And then we open it gradually, people 40 and above, then it was 35 and above, and then for everybody. And again, I'm not sure this part is relevant for many countries, because we were very fortunate that we have enough vaccines. I know that in Italy, for example, they're doing healthcare workers and people that are above 80. My sister lives in Italy, as you know, and they're going to be vaccinated. So maybe even my sister will come to Israel to be vaccinated, because she's an Israeli citizen. So when there'll be the option, she can come here and get her vaccine. There are people that started to develop ideas about medical tourism, but this is really crazy.
Yeah. And another specific question: how is Israel handling individuals who had tested positive for COVID prior? Where do they fall on the vaccination queue? Do they have to wait a particular amount of time?
Right. So this is a major debate right now, and there is no clear answer. I would say that for now, people that recovered, they were positive and recovered, they are not vaccinating now. At the beginning, it was a question of priority. Now it's a question of understanding exactly all of the immunity. My opinion, reading all the literature and the studies, blah, 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 is that probably we'll have people that recovered, that were positive, to have one dose. But that's right now, maybe to be at least 3 months after they were positive, but it's not settled yet. There are lots of discussions. I just had like a 3-hour discussion just yesterday about this question. Because it's not just about prioritization, it's also about the immune system, and again, the fear that maybe people will get more adverse event because of it. But so according to Pfizer, it's not a contraindication to be vaccinated. I can tell you that many people in Israel also got the vaccine in different ways. Israelis, they know how to find the way. But this is not a formal policy. And we're still waiting. So for now, they're not in the list for vaccinations.
Okay. Thank you, Nadav. So we've had somebody ask about how MDA stations were utilized in the vaccine rollout, and maybe you could start by describing MDA stations.
Right, sorry, so I forgot to mention that. It's very important. It's another component of the success. So MDA is Magen David Adom. It's the equivalent of the Red Cross. It's a Star of David, the Red Star of David. It's part of the International Red Cross Association. And they were extremely helpful in vaccinating all the people in elderly homes, people that were debilitated and couldn't go to the clinics. It was a major campaign. I won't get into the logistics. It's not so simple, especially with Pfizer, all of the cold chain, etc. So they vaccinated very quickly. They were all, of course, first priority, people in elderly homes. We all know that around the world it's a major risk. And now we have almost all of them, all the elderly homes vaccinated, and that's an amazing success story by itself. Now the question, how they should behave. Can they have back? Many elderly homes, you have like cultural events or just playing cards, or I don't know. And probably from next week, places that more than 95% of them were vaccinated can go, to almost regular activities within the elderly home. Yeah.
All right, thank you. One of the challenges we face in the United States, of course, is not only the absence of a strong surveillance system and variation state by state, but also basically zero, almost no genomic sequencing. What kind of effort is Israel putting forward, what kind of genomic sequencing from a public health perspective. And I'm thinking not just for the sake of knowing what's out there, but really understanding what the prevalence of some of the different variants of concern is. And then how is the public health system using those data to direct public health interventions, either increasing vaccination uptake areas and efforts in some areas. What's the state of genomic sequencing surveillance?
So I was working for maybe 18 years, Amy, to bring genomic sequences because it's a major public health issue, not just in COVID. And it's a long and frustrating story. Already in February, we called the government to invest. And now we have a very good system because finally, after 18 years, because of COVID, like many other things, finally the state invested all the money needed to do it properly. So now, and it's very sad because we think that we could prevent quite a lot of what happened and the rapid, entrance of the UK variant that probably started already in September, and especially during the high holidays in Israel, that many people came. It's a very frustrating story, and I was just shouting yesterday in the parliament about it because it was really crazy. We because of the peace agreement with Dubai, so, and by the way, also because at the beginning we didn't want to offend Donald Trump, so Israel was open to the US. It's something similar. It's not related to the variants, but it's about, we have only one major international airport, so it was quite easy to control, and it's really a shame. But so we introduced now the genetic sequencing, and now it's an integral part, including, by the way, it's also about tracing super spreaders, and doing epidemiological investigation in a much more sophisticated way than it was before. I wish that we didn't need the COVID-19 pandemic to do so, because this whole system, it's important for antimicrobial resistance and so many other things. And by the way, all over the world, it's a major problem. Apart from the UK, it's not a coincidence that it was discovered in the UK. It's not clear at all that it started in the UK. Same thing in Denmark. Remember the minks and what happened with them?
Yes.
So Denmark, they also have a very strong genetic sequencing. So this is why they discovered now, of course, all over the world, it's very different. So that's another important point. Amy, I think that I have like 2 minutes because I need to enter into a Ministry of Health discussion.
I know, and I'm watching our clock too, and I loved that that you ended on a note. You began on a note talking about vaccine being one part, not a magic bullet, and you and I both have connections to Alan Brandt, who made that a famous phrase. It's not a magic bullet. It's a part of a comprehensive strategy. COVID has to make us think about systems that go beyond COVID for both the sake of our national health and for the sake of global health. So Nadav, thank you for taking your time at a time in which I know you have not a lot of time. And I do hope I'll be able to bring you back in to talk about vaccine passports and your green standard at some point when maybe you have a little bit more breathing room and some experience with that. So thank you so much. Thank you so much, Nadav.
Such a pleasure. And yes.
So, all right.
Regards to the
bye,
family.
Nadav. And I look forward to seeing you face to face again. Bye-bye. Thank you all, and thank you all for attending.